I have been doing medical optometry for over 30 years. I did my first rotation through Walter Reed Army Medical Center in Washington, D.C. back in the late 80s. I'm going to date myself here. But, and dry eye disease is a new area in eye care that has garnered a lot of attention in the past 5 years. So in 2015, I started trying to find ways to help my dry eye patients from the typical treatment, which was eye drops. Dry eye disease is usually evaporative, or it is a lack of aqueous production, or it's a combination of both. Studies have shown that 85% of dry eye is caused from meibomian gland dysfunction, which is a loss of the glands that produce oil. That oil layer, to our three parts of our tears, is the most crucial layer because that is the barrier that keeps the thicker water layer on the eye. And if that oil layer is missing, you're going to have evaporation of the water layer, which then breaks down to the thinner, closest layer to the eye, which is mucus. And it becomes a cycle, if you will, of dysfunction. So dry eye disease can be caused by hormonal levels, eye surgery such as cataract or refractive surgery. It can be caused by your medications. If you're taking medications for high blood pressure, diabetes, or antidepressants, patients who have Sjogren's disease are also, which is an autoimmune disease, are also prone to severe dry eye. Dry eye is a disease that affects your wettability of the cornea. The cornea is what gives us our clarity of vision. And if that surface becomes dry or desiccated, it can decrease your vision and cause you a lot of functional discomfort. Our tears are made up of 3 layers. The outermost layer is oil, the thickest inner layer is water, and the layer closest to the eye is mucus. So if one or all of those layers are disrupted, the tear is not going to function properly. So dry eye disease in the latest studies has been shown to be 85% due to evaporative dry eye disease. Evaporative dry eye disease comes from a lack of your meibomian glands producing the top layer of oil. So with dry eye disease, we need to isolate what and where it's coming from. There is no cure for dry eye disease, and that's very important for people to understand. It can be diagnosed. The treatment for dry eye disease can range from just use of artificial tears or heat on the eyes or a combination of many other things. I do not hold to the theory that artificial tears is the only thing we can do for our patients, because if you evaluate your patients, you're going to find out if there's inflammation. Inflammation is key. If you have inflammation, how do we get rid of it? If it's not inflammation, is it a lack of oil for your tears? If it's a lack of oil, how do you get more oil to those eyes for that patient to be at a comfort level? And if it's a combination, then you need to address all the factors that are causing the dry eye disease. But there is no cure, so it has to be clear that we can make you feel better, because there are methods to do that, but there is no cure, and every day is a different day. People ask all the time, can you prevent dry eye disease? It's not really a matter of preventing, but what can you do to alleviate the possibilities of you becoming a severe dry eye patient versus a moderate versus a mild case? Blepharitis is one thing. If your doctor has told you that you have blepharitis, which is inflammation around your eyelids, that's something that needs to be taken care of, because that can lead to a loss of your meibomian gland function, which leads to the severity of your dry eye disease. So prevention, well, you can wear sunglasses for windy days. You can use artificial tears just to keep your ocular surface lubricated. You can take omega-3s. Omega-3s are very important in the nutritional aspect of treating dry eye disease. Omega-3s are not all created equal. You need something that's high in EPA or DHA. And also, we have found that GLA6 amino acid is also effective in increasing the consistency of your meibomian glands. So it's not so much the things that you can do to prevent it, but there are things that you can do to maybe alleviate the severity of your symptoms. So patients ask me, relatively all the time. Is there something that they could have done to prevent dry eye disease? And my typical answer is not really. Education is key. The more you know, that's going to help us make decisions going forward. So with the advent of dry eye disease care, what can you do? Keeping your eyelids clear of debris, such as makeup, such as artificial eyelashes. Those things are putting sources of bacteria, where bacteria can breed on the surface of your lashes. That's something that you can control. Also, your medications. If you can consult with your doctor about medications that may be causing dryness. When patients come to see me for their dry eye care, they are typically at their wits' end because they have suffered with this disease for so many years and have not really achieved any success by using artificial tears. So my workup will determine what we need to reintroduce back to your system. If you need oil to your tears, I have processes to thermally heat up the meibomian glands to get them to release the meibum that may be clogged in those glands, to get that to the surface of the eye where the meibomian glands are designed to provide a protective barrier to your water layer. If you have a low aqueous or water layer to your tears, well, there are medications for your lacrimal gland to help increase the production of that, or we can use punctal plugs or other methods. I typically like to tell my patients that my treatments are naturopathic. I do not do anything invasive. I try to stay away from prescription medications because I personally have found that they don't work. So why spend that money on drops that you're stuck in a cycle of maybe 90 days to try them, and 90 days are up and you're no better. So when people come to see me, I give them treatments that will take care of their blepharitis, such as removing any scurf or buildup on your lashes, and that is called BlephX. We also do MeiboFlow. MeiboFlow is stimulating the meibomian glands. It's a relaxing, lovely lid massage. And my ladies and my men, they leave here relaxed because it is a very comfortable way to get your meibomian glands stimulated. And then there's LipiFlow. And LipiFlow is the gold standard of care for dry eye. But LipiFlow in my armatorium of care is something that I reserve as a preventive measure. It's going to keep those glands from further atrophy, and moving that meibum, once it is heated up, it's going to then be expressed through the glands. And those are just the 3 different things that on a very short term can be done here in my office in one day. And in a week, when you come back, you are going to have significant subjective improvement. And that's where it matters. It's not always objective that matches the subjective. And if the patient comes in with complaints, I want you to feel better when you get out of here. I want you to feel better when you come back. And so the procedures I do are all naturopathic to that end. I don't want you to use eye drops all day long, and you don't have to. Elite Dry Eye Spa is a concept that came to me several years ago based on the need of my patients and myself. Dry eye care was at a standstill. All we do is provide patients with a prescription for drops. So what better way than in a spa environment to have your eyes evaluated for a disease that's causing you pain and discomfort in a relaxing environment, one that you will feel like you're getting a service, but it's not an invasive service. It's comfortable. We have aromatherapy. We have a massage chair. Your workup is done in a very nice, comfortable environment. And when you leave Elite Dry Eye Spa, you'll understand the elite part of the eye spa because I am in a Medi-Spa environment. And so my services are directed to providing a treatment, but a treatment in a relaxing, calm environment. So Elite Dry Eye Spa is the ideal way to receive dry eye care and still have a professional examination along with that. I'm often asked, do I accept insurance for the procedures and treatments that I perform here in my dry eye spa? Unfortunately, the answer is no. Although my procedures are proven to be effective and safe and do provide relief for your dry eye signs and symptoms, insurance companies still consider them to be experimental at this time. If you're interested in a professional dry eye evaluation, give me a call. I'll be happy to discuss your signs and symptoms, and we can make an appointment at the earliest convenience that fits your schedule.